Hello and welcome to Healthy, Fit, and Pain Free Pittsburgh. I am your host, Ryan Wade, joined by my co-host, as always, Dr. Tyler Bordick.
Hello!
Today, we wanted to start diving into really some just tangible points of emphasis that we see a lot of people being restricted by in their health and their fitness. And so today we wanted to start off our little subtopic that we want to call Doc Talk. And today we want to discuss the topic of arthritis, namely osteoarthritis. Arthritis is something that we see a ton in our practice as something that holds back so many people. I think a lot of times out of fear, a lot of times out of the amount of pain that arthritis brings, right, is scary to a lot of people. And I think the biggest concept that we like to talk about that really isn't mainstream is exactly, what is arthritis? Where does it come from? What is it actually doing to you? And what are some steps that we can take to start to get you out of pain and really start to move towards a more active and movement-based lifestyle, free and healthy lifestyle, right? We want to get back to doing the things we love with the people that we love. That's the mission. That's the goal, right? And arthritis we think that it holds too many people back because we think that you're a lot more, we know that you're a lot more capable with arthritis than you really, than a lot of people may believe. Right, and so today we want to start to put an end to a little bit to the fear, right? We always want to treat our body with respect, and I don't think that we're trying to overstep that boundary. But I definitely think that there's a lot of things that can be said, and really to empower a lot of you out there with osteoarthritis to be able to get back to doing those activities that you love. So, Doc, go ahead, man.
Yeah. So, exactly. And that's the big reason why I wanted to do this podcast is because, a lot of times people come into me and they have these false beliefs, these false narratives, and a lot of times it's not their fault. People, it seems like a very scary thing, and the first thing that people do is they get on Dr. Google, as I call it, and that they start to they see all these pictures, and they they see surgery, and so what they do then is they go to their doctor, and again, the doctor in and out quickly, and sometimes some words that he says stands out, and then a lot of times then they're just become even more confused, and all they hear is fearful words. We always say, whenever you're talking with someone, if you want to communicate well, watch using big negative word, because a lot of times that's exactly what people kind of fall into and what they think about. So, and really it's just to provide you with an objective understanding. It's taking you, helping you to step out and just look at the big picture. And just really, instead of getting your fear, your feelings, your pain involved with it, really seeing arthritis for what it is. Also, I want you to understand classifications. We're going to go through, I'm going to use some studies, research. I promise you I'm going to try not to put you to sleep with this podcast, but it's really, again, just so you can kind of understand classifications and what exactly the stages of arthritis are, and really just make better decisions. So that's the biggest goal out of all this that Ryan and I have for you. So
sure. So let's dive in. And first, Doc, can you just give us a really less convoluted view and definition of what arthritis may be to people that have it, may think that they have it, their doctor has told them that they have it, but didn't explain exactly what it is or how it should or should not impact their activity?
Sure. So let me start off by giving a very non-biased approach of exactly what arthritis is. And arthritis, the Arthritis Foundation actually claims it as a normal process of degeneration within the joints and bones of the body. Now, one thing they also say with that definition is that it's very wide range of what exactly arthritis is. It's wide ranges of whether it's pain, whether it's symptoms, whether it's how it affects you functionally, and it's really a not well understood topic.
Okay, so and forgive me, I may have missed it, but tell us, give me one sentence of what is arthritis.
So arthritis is the natural degeneration, arthritis is inflammation of the joint.
Inflammation of the joint. That's it.
That's all it is.
Right. Not so scary.
No.
No, not so scary. Now, so there's inflammation in my joint. Let's say it's my knee, right?
Hold on real quick while I'm thinking about it. So, again, inflammation might be a scary term too. Inflammation is just a reaction in the joint, okay? We have inflammation every day. Every time you eat, in your intestines, there is some sort of inflammation that occurs. Every time you work out, there's an inflammation that occurs. If you have a little injury, there's an inflammation that occurs. If you have there's inflammation every day, so this is not uncommon.
So in a very elementary question, and maybe tell me if I'm breaking this down too much, and we'll kind of dive back toward it at the end. But from what you're saying, if arthritis is inflammation in the joint, if I address my inflammation, I am therefore addressing my arthritis, and it should start to be curbed a little bit, at least.
Correct.
Okay. Yeah. Great. So, are there different classifications or different magnitudes of inflammation in the joint? Is there a difference between, is it like a sprain? Like if I sprain my ankle, right? There's like a grade 1, 2, and 3 sprain. Is there a different grade of arthritis?
Yeah. So there's a classification system called the Kellgren-Lawrence classification system, and so I'll break this down for you. So number one is doubtful, and what it's referring to is the narrowing of the joint. So the first quote-unquote stage is doubtful narrowing with possible osteophytes. So osteophytes broken down. I hate to use this term, but it's essentially a bone spur. Or instead of a bone spur, let's say a bump in the bone. Okay. A little bump forming in the bone.
A little bumpy.
Okay.
Got it.
So the next one is going to be mild. So mild is just mild narrowing. And then there's going to be a little bit more of those bumpy bone formations or osteophytes or bone spurs. The third one is going to be moderate. So moderate narrowing, a few more quote-unquote spurs forming, some sclerosis with just as breakdown really, and maybe some deformity starts to form at the end of the bones.
So whenever you say spurs, right, and I know you don't like the term, right, and we generally don't like the term, but spurs is basically, and again, I'm not a PT, I'm not in the medical field, right? But, so I may be a little biased when I say this, but spurs is basically just a scary term they use whenever they take a picture of your bone, right?
Sure. So a lot of time, and I don't have anything to back this up, but really what spur came to is when you look at it could be formed by someone just wanting to scare you into surgery, but really what a spur is, if you look at an x-ray, there is a buildup somewhere that almost looks like a quote-unquote sharpened end. So that's where like a spur comes into play. And really how this stuff forms is whenever there's certain forces on bone, whether it's whether it's tendon, whether it's force, our body, to react well, lays down more bone in that area because it wants to protect it more. Mm-hmm. So typically there's an abnormal force somewhere, and that's why this kind of form. It can also be very normal. Like there's some people that have spurs just form just because of certain forces in the bone.
Sure. So whenever I think about it, I always like to try to compare things that I know to things that I don't know, right? And so if I'm thinking about what you're saying as a bone spur, I kind of think about it as like a plant that's being like compressed up against a tree or a fence or something, and it kind of grows these little growths on it, right, to try to expand because it has no more room to grow up, right? And we don't call that like a scary flower spur, right? It's just a growth, right? We don't even prune it, right? Like the flower is perfectly healthy.
Yeah.
Would you say that's a fair assessment of comparison to what we are? So it really, these bone spurs or growths or bumps or whatever you want to call them, they're really nothing that we should be afraid of, right? Now, it may feel painful, right?
It depends.
Okay, so what's it depend on?
Exactly. That's what we don't really know. And that's the funny thing that's why I always say, like, don't be too thrown off by a bone spur, because a lot of time bone spurs, we have natural bone spurs in the body that aren't actually painful, and there's a lot of research out there that there's people who have bone spurs underneath tendons, and like in the shoulder, for instance, the knee, they'll have bone spur formation and will have no pain or dysfunction.
So why, if I had a bone spur, does my my PCP or my ortho send me to go get an image because I have bone spurs? Like, why are they trying to scare me?
So typically, and then this is where a big issue, and if you follow me, you see this all the time that I put this out there. You have pain, you go to your doctor, and you tell your doctor you have pain. So your doctor only has 15 minutes with you, so they don't have time to do a full evaluation with you. But so they send you in for an X-ray and MRI. Now, because X-rays cost a lot less than what MRIs do, they'll do X-rays first. X-rays are very sensitive to any type of change in the bone, or not, depending on how you look at. But they'll look at these X-rays, they'll see little formations there, and so they automatically say, there it is. Mm-hmm. That's what's causing your pain. There's a bone spur there. Mm-hmm. And that's not always the case.
Okay, so what is the purpose? Like, why is that doctor, the PCP or the ortho, like, I have pain due to arthritis, I have inflammation in my joint, and I have some quote unquote spurs or bumps, right? Mm-hmm. Why am I going to get an image in the first place? Shouldn't this just be able to be taken care of with exercise?
So yeah, $100 question or $1 million question there, I should say.
It's actually like $2,000.
But no, a lot because really it comes down to answers. Patients want answers to what is wrong with them. Doctors want to feel superior by giving them an answer. And I'm not saying that to bash doctors. I too would love if someone came in for me to give them an exact answer of what is going on with them and why they are experiencing their symptom. And sometimes that's not always the case. When you do an image, you now give it you give it a diagnosis. So now they have that one thing to go off of, which can be dangerous. So
you're saying they do it because they can, and because they don't have the time to accurately give you the full description, so they want to just show you a picture.
Yes, that can definitely be one of the reasons for sure. I'm not saying they all do that, but yes.
What might be another reason, just to be fair?
Well, I hate to say this too, but a lot of times, if it's a construction worker, give them a hammer. If it's a chef, give them a skillet. If it's a surgeon, give them a knife. Mm-hmm. And what do they like to do with that knife?
Show it off.
They like to cut. And so a lot of times with surgeries too, not all are like this, but I've come across many doctors who someone goes to them, they have a bone spur, the first thing they want to do is go in, they want to shave it off. Which, really there's some research saying that there's less than a 50% chance that shaving off is actually going to work. So if that doesn't work, then it wasn't the bone spur now, was it?
No, and I would say, I'm not a doctor, right? But I tend to just take context, again, from things that I do understand. Mm-hmm. And I believe, shaving off a bumpy part of a bone sounds a lot like pruning. Mm-hmm. Right, and most often pruning, like the part that you prune, comes back.
Yeah.
Right, and does the body work that way?
So there really is no pruning that happens, but there's what we call desensitization, and what this just basically means is your body gets used to that certain stimulus, and then it's not as alarming anymore. So it kind of just shuts it off. And again, we don't even know if that's the point. So for instance, there was a study done by Colvinor and the British Journal of Sports Med. And this is called a systematic review, and what this means, they just look at several studies and compile them together. So 63 studies, there was over 4,700 adults in it, and up to 43% of them ended up having osteophytes, or quote-unquote bone spurs.
Close.
And, yeah, and narrowing of their, this was the knee joint, so narrowing of the joint. And none of them had pain. So it just kind of goes to show you that it doesn't have to be that way. It's not always the cause of pain. And
when you say narrowing, you mean the inflammation basically coming from the sides, kind of meeting towards the middle. It's narrowing the gap of the joint.
Sure.
Okay.
Yep.
Just for clarification for the audience. Yep. Sounds good. Okay, cool.
That's why we have you here, Ryan.
Yeah, I am one for the people.
There we go.
In this podcast. If I have inflammation in my joint or arthritis, right, and I have pain, and I may or may not have bone spurs, mm-hmm. right, and let's say I am someone like us, and I don't believe that imaging is really going to give me the full answer, and I don't want to get my bone shaved off my leg or my knee or my foot, right? What should I do?
Well, there's a lot. So there's many ways that you can help treat osteoarthritis or osteoporosis too. I mean, these two can kind of run together, so you can kind of do both of these. But one big thing, really understand if you're overweight, because excess weight equals excess stress on the joints. You can have anywhere from 4 to 10 times excess stress on your joints just based off weight alone.
Sure. We usually estimate at about 7 pounds of force per additional pound of body weight over your ideal body weight. Yeah. Okay.
So with that too, that and exercise. So there was one study done where it showed that just a 30% difference in strength between both, so again, we're looking at the knee here. There's also some studies of the hip that it's just that little bit of weakness can increase your severity of pain, especially with osteoarthritis. So, there's been studies too where if you get those people on an exercise regimen and they gain that 30% increase in strength, they will in fact have a decrease in pain. So that study, there was another study done where they used lifting intervention for training muscle and osteo rehab.
When we say lifting intervention, we mean resistance training.
Yes.
Weight training.
Yes. I'm just quoting what the study
Sure,
is.
I just want to give people the everyday terms.
Yep. And so they looked at 28 women doing 30 minutes of high-intensity exercise. So that's just, we're looking at resistance training again, weightlifting.
When you say high intensity, you mean just higher heart rate?
Yeah, higher heart rate, not actually throwing you through the roof. Versus low intensity, they found, and this is for osteoporosis, women with osteoporosis too, so they saw an increased height, increased bone mineral density, increased lumbar spine density, so the bones just become bigger, so they support better, increased functional performance, and no injuries.
So we're saying, basically, to summarize that resistance training builds the strength of the bone.
Correct.
Okay.
And
go ahead. So all right, so let's say, again, I come back to you, same situation that I said before, right? I have that diagnosis. What would you prescribe me?
So obviously this is what I do, but honestly, conservative measures are the best. So for one, it's like we said about weight loss. 2 is strength. So I always say, if you're familiar with like cars, like the struts in your car, so like your suspension has the struts, and then it also has your suspension, which is like your spring system and everything else with it. So your bones basically are compacting together whenever you walk, run, whatever. Okay, that's without any support whatsoever. And that's like your meniscus. So meniscus is the popular one. People say, oh, I have a meniscus tear. What your meniscus is just a passive structure, meaning it doesn't really do anything. There's no contracting of the meniscus. But it sits there and it cushions your knee joint as you walk, run, etc. Okay? But that joint is also surrounded by muscles, tendons, ligaments, and what these structures basically do is support that joint. Okay? So by improving the strength of those muscles, improving the reaction of those tendons, and even your neurological system, you become more reactive with activity, which means less stress on those joints. So get stronger.
Get stronger. Okay. All right. Good to know. Now, something that I know we've touched on in the past, I don't think we've said it on the podcast, is that, maybe you do have arthritis. Maybe you do have quote unquote bone spurs or bumps on your bones and maybe some mild to moderate to maybe even higher than moderate pain. There's a lot of people that can help you, right? You got your PTs like you got your chiropractors, your people might go to see a PCP or an osteo or whatever, right? And I think each of these specialists kind of have their own tools, right, that they use, like, or explanations or however, right? Like a PT is going to prescribe exercises to promote balance, right? A chiro is going to make spinal manipulations, and an osteo is going to send you to get an image, right? And a PCP might give you like a handful of painkillers, or muscle relaxers, right? And I think the biggest thing where people get really frustrated when they just have something as simple as, again, go ahead.
Real quick while you're on that topic. So Also, other problems. So muscle laxers. So muscle laxers are meant to downregulate the system in hopes to downregulate your pain level. Now, that being said, let's think about this. I just said that studies show that the stronger you become and the more reactive you become to outside forces, the better you can, handle pain, and the better you can handle, your symptoms with arthritis. Now, if someone gives you a medication that takes away from that reactivity and takes away from that strength, you see where I'm going here?
Yeah, it's not going to do anything.
Yes.
Yeah. Okay.
Maybe the opposite. So.
Right. Okay, so warning label.
Yes.
Okay, so warning label. But going back to my tools in the toolbox kind of example, right, is that we've got all these different specialists, all these different cooks wanting to use different kitchen appliances, right? And where people get really frustrated is because there's not a really linear or even cohesive answer for them, right? No matter who they go see, they're getting told something different. Super frustrating. We're wasting a lot of money going and paying for all these different people to tell us completely different things. So I think the best thing that we can do, given our platform here, is to give people the tools to be their own advocate, right? Is giving people to not have to rely on as many people to be able to resolve their own problems, right? And so, I think the way that we can do that is to express and to tell our audience, what tools do you have at your how do I say that? What's that term? Disposal. I was going to say exposal. That's not the correct word. How many? Give them the tools that they can have at their own disposal, and basically show you what is it that you can control yourself. Right? And so that we don't have to go through all the frustration of all this. Obviously, if you're in immense pain and you have no idea what's the matter with you, you should consult with a doctor, right? And we're not saying not to. But if you have mild to moderate pain, right, I think a lot of times that can be amplified by things like not enough sleep, too much stress, right? Drinking too much alcohol, eating inflammatory foods. Go ahead.
Even whether I hate using this one, but I've had so many, I've talked to a lot of doctors and even patients who, like, God forbid, these last 2 days of the blizzard of Pittsburgh to start off December, people have flared up a little bit. Like, weather can. Now, I say, like, I hate, like, have control over that, though. Don't make it like, oh, tomorrow's. I had a couple patients in the past, for instance. Way long ago when I was a young PT, who every day they would check the weather to make sure their arthritis wasn't going to flare up the next day, which is not healthy because then you were just setting yourself up for failure and thinking about it.
Sounds a lot like checking is the cause of the pain.
Yes.
Okay. So again, we've thrown this fact out there, but stress delays healing by up to 60%. Right. And so anything you're doing to add additional stress to your life can therefore upregulate your system, bring about symptoms of pain that you may not even know that you had. Right. Okay. Good. So getting back to controlling what we can control.
Yeah.
What's your actionable advice? Very simple and succinct directions for somebody to give them the tools to be able to handle their own pain, not have this stress response of freaking out, not knowing and understanding why they have pain, but understanding their osteoarthritis for what it is, which is simply inflammation in the joint and possibly some bumps on their bones that due to growth and the bones not being strong enough have kind of expanded.
So I think really, it comes down to, now obviously I'm biased when I say go to a PT, but really you've got to go to a credible source. Go to someone, whether it's a credible strength coach, which is kind of hard to come across if you know.
So it may be hard to come across, but let's say, what is a credible, I'll say it for you because you don't want to. Sorry about that. Because you don't want to say it. A doctor of physical therapy. Right,
Sure.
A DPT is a qualified physical therapist. They may have specializations in things like osteo, right, or orthopedics, or something, whatever that is, right. And but a credible strength coach, right. I think a lot of people in there just don't understand the very low barrier of entry to personal trainers in the market.
Yeah.
Because basically you can call yourself a personal trainer as long as you like get online for 2 hours and take a quiz, right? in some of these places, that is not. There are different levels of certifications, and they are not created equal. Mm-hmm. So, what are some of the good ones? What should I be looking for? And if you don't have a credible physical therapist around you, right? Maybe a strength coach to help you get stronger and strengthen your bones would be a good secondary source to look at. What makes a credible strength coach?
So I would look for someone who at least has a bachelor in like exercise physiology, exercise science, like something in that. Someone who went to school for that. And not saying people who didn't go to school for that aren't credible, but at least they have the education backing what they're saying. The other thing too is just go in there and talk. Actually sit down and talk with those people and grill them. You listen to this, you've heard like from a PT standpoint, and even from Ryan's experience as well. You've heard like what to and what not to do. So go and grill them and ask them. What would you have me do? What is your advice for me? What are we going to do in here? And just kind of see their process with you. Are they going to address your eating? Andrew Wade, Case Specific Nutrition, him and I have talked about this before.
Friend of the show.
Yeah, friend of the show. shameless plug for him there. But we've talked about before, and he's done some anti-inflammatory based diets with people because that's been shown to help people anecdotally. So,
sure.
And even some research out there. So stuff like that. Are you going to address their fitness level? Are they going to address your strength? Just the most conservative approach.
Yeah, I think you bring up a good point that I wasn't even thinking about. And I'm the strength coach here. Well, we both are, but I'm only a strength coach. I was going to say, there's a lot of certifications. For what it's worth, I think the best of those certifications are the NSCA, the National Strength Conditioning Association, the ACSM, the American College of Strength or Sports Medicine, and ACE. I don't know what the acronym stands for, but it's a good one. And everything else is kind of below that.
Yeah.
For me, ACE may even be on that borderline. But what you said, I think, was even more important, which is sit down with the person and make sure that they are asking you questions about you and that they care about how to get you better.
Sure.
Because just because they have the certification doesn't mean that they're a good strength coach. It means they know how to take a test, right? Mm-hmm. And unfortunately, the conditions of the market are, because the barrier is so low, there are a lot of personal trainer strength coaches who are out there for the wrong reasons, which is just simply because they enjoy exercise. Yep. And not necessarily because they know how to help people or because they enjoy helping others, right? And so we have to be on alert for one of these lower quality personal trainers or strength coaches in disguise having some letters after their name, but just being there because they like weights.
Well, you know what? And let's be blunt here. Let's not just pick on personal trainers. I mean, even your doctor, like, I'm sorry to say it, but again, this is, we're not being biased here. Like, this is this is research. This is experience from, a combined 15 years in this field.
Sure. And if there's a doctor listening, please send us a challenge. We'd love to research with you.
Yeah, exactly. And but that's the thing. If you go to your doctor, they should try to take a conservative approach with you. Because, I've had patients who they go to a doctor, they have a little bit of arthritis, and the doctor's just like, oh, you need a total knee replacement. And meanwhile, they've come to me, I've done an assessment on them, and they don't need a total knee replacement. They are far from needing a total knee replacement. And it bogs my mind. And again, if someone with a scalpel likes to cut, and that's exactly what it is.
Again, and this is not... It may sound very biased against doctors. However, and I think as I start to talk to more people, I think that that general MDs and PCPs and things of that nature, I think they're coming around more to the idea of proactive medicine. But to the vast majority, I think, of the profession, they study reactive medicine, which is how can we react to what's going on in your body instead of how can we improve the processes that got you to how your body is reacting, right?
So something else, real quick, to add to this. So, I shadowed a doctor. I've shadowed a few doctors before, and who are very conservative based. And the one I'll never forget, the one day we're in the office, and this person comes in. They're like, "I went to this doctor. He said I have bone on bone," which, by the way, is such a garbage term. If your doctor tells you you're bone on bone, just no, don't punch me in the face. You can't do that. But just walk, because
call them a liar.
it's such a horrible term, because when people hear that, they automatically, think about it, bone on bone. Like, it just sounds horrible.
Right.
Like, yeah, anyhow. So
what do they actually mean when they say bone on bone?
So that's the thing. So also realize that imaging is up for interpretation. So again, going back to the story. So I was sitting down with this guy. This person came in. Their doctor told them they had bone on bone, and there was no hope for them. So this person came to this guy because he was a conservative doctor. He had other approaches first before sending him somewhere to get surgery. He looks at this person's X-ray, sits back in his seat, and just starts dropping F-bombs. So I'm like, "Hey, you okay? You okay, buddy? Like, everything all right?" And he said, "This is what pisses me off, is the fact that, look at this imaging." And we both looked at it together. This person had mild, maybe just like maybe tiptoeing into moderate arthritis. And this doctor told them they were bone on bone. He said, "This is what makes me mad, is people come to me and I look at their imaging, and just because imaging, there's no AI with imaging. You don't spit out an imaging and then the computer tells you what you have. A doctor literally looks at it and then tells you what you have. So you could have 10 different doctors look at the same image and say 10 different things." And not to mention, there was also a study where they had doctors look at imaging and then look at the same imaging with the picture of the patient, and they actually read the imaging differently because of the empathy they had for the patient. So I'm not saying this happens all the time, but it just shows you how quickly and how subjective these can be sometimes.
Sounds a little too much like translating art to me.
Exactly. Exactly what it is. And so just realize that you have a human in front of you who can make mistakes, and don't always take that for what it's worth.
And so what should, I think we're getting a little bit in the weeds, but I think we need to wrap this up by saying, like, what is a better way to do it? If imaging is kind of a crapshoot,
mm-hmm.
right? What would be the better way to handle that?
Yeah, I got off my soapbox there. So honestly, the first thing, if you're experiencing pain, if you're experiencing some sort of dysfunction, you can go to your doctor. However, a lot of areas now have direct access with physical therapists, chiropractors. What that means, you can go straight to them without a doctor's script. Go there and at least let them give you the tools to start your approach. And then from there, you can take those tools yourself, or have your physical therapist, your chiropractor, whoever, then recommend somebody else to go to, whether it is a trainer that they know or someone who can continue to help you with that and get you out of pain. Because I know we have people who come in here who they started off, they're like, "I can't go up steps, my knees really bother me, please help." And we've helped them lose weight. I hate, not that I'm putting us on a pedestal, but they lose weight. They get their diet in check, they get stronger, and now they're going up and down steps with no problem. And so it's very easy to do that conservatively. You just have to take the right approach.
Yeah, and I think, again, going back to the purpose, is that people want a concise kind of just toolbox or a plan to be able to address these things themselves, to keep that a conservative approach, and just avoid the frustration
mm-hmm.
that comes with seeing all these specialists, seeing all these people getting 5, 6, 7 different answers. I think we got into the weeds a little bit there. So if you could just wrap it up, a couple bullet points. I have mild to moderate, even more than moderate, arthritis. I got some pain. Maybe even some bumps in my bones, right? Or quote unquote bone spur.
Mm-hmm.
What are, again, a handful of tools or things that I can do to mitigate that to the best of my ability, and use a specialist, a doctor, as a secondary resource after I use myself?
Mm-hmm. So first is hydration. Hydration's huge. The more hydrated you are, the more lubricated your joints are. So that's a big one that kind of goes without saying. If you drink alcohol, reduce your alcohol. We all like to have a drink, but alcohol is does cause inflammation, and so you don't want to add inflammation to inflammation. So if you smoke, stop. Simple. And then, lose weight if you are overweight, and, if you're not on an exercise regimen, get on a guided exercise regimen, and one that's progressive, one that they continue to increase, your intensity, your weights, whatever. If you're doing the same thing for a few months, then you're not on a progressive program. Educate yourself. Keep educating yourself with the right people. Don't get on the internet, because God forbid you'll go down a rabbit hole and you end up on a surgical table. Educate yourself with the right people. Keep yourself calm. Understand that this pain could be temporary. It could just be a life situation. It may just be stress. God forbid we're going through a lot of stress right now. And just really find a team of people that want to take a conservative approach with you and walk.
Okay. All right. So there's the much higher educated but still simplified version of this. I think myself as a strength coach, as a trainer, as somebody who now leads teams of trainers, and somebody who has been a team coach and a motivator for a lot of people. I think this may be too often said, but I think that it always comes around. It's just so true. Being in pain is hard. Being overweight is hard, right? Getting out of those things is also hard, mm-hmm. right? And so it just makes sense that being there and getting out of it is both going to be hard. I think if you look for a simple solution, you're probably stepping over some of the solutions that are harder but more effective, mm-hmm. right? And I also think that again, and I think we've all seen the meme or whatever, but just choose your hard. Mm-hmm. Which one is it? Which one do you want? Do you want a life of pain and inflammation and weakness and everything that goes along with that, or do you want the heart of scheduling the hour of your day to exercise and get stronger? I don't think there's any situation that I can ever think of, despite what anybody's ever told me, that has proven to me that there is any negative effect to getting stronger.
Mm-mm. No, it's either success or regret.
Yeah, very simple. So, anything else, Doc?
That's all.
That's all for today. Cool. Well, we hope you took those notes, if you have arthritis, namely osteoarthritis, to be able to put a little plan together and be able to help yourself. If you are not confident in you being able to help yourself, our show is sponsored by Inner Strength Physio Fitness Athletics. That's obviously where we are from. We have Dr. Tyler, our in-house doctor of physical therapy, along with our highly qualified team of personal trainers who are here to guide you down the path, no matter to greater health and fitness, so that you can do the things that you love with the people that you love without fear of injury, pain, or embarrassment. We put together customized solutions for everybody. Right, and so whether you have arthritis and you've not been able to work out in the past, or you just are a newbie, or you've actually been working out before, we can definitely be able to put together a plan that is going to work for you with the appropriate steps to get you there. And with our partners at Case Specific Nutrition, who are also a sponsor of this show, we can even put together a anti-inflammatory diet to be able to address those inflammatory factors that could be contributing to that arthritis. So the whole package kind of comes together. We thank you very much for listening, and we'll see you on the other side.